the Toronto Star, I'm Saba Itazaz, and this matters. The scientists warned us. They said a virus that does not discriminate can only be defeated by a world that does the same. The world did not deliver.
More than 80% of the world's vaccines have gone to G20 countries. Low-income countries, most of them in Africa, have received just 0.6% of all vaccines.
And now Omicron is among us. You just heard WHO Director General Tedros Adhanom Ghebreyesus pleading with countries to do their part to tackle vaccine inequality, saying that this will not end unless the vaccine crisis does.
We understand and support every government's responsibility to protect its own people. It's natural. But vaccine equity is not charity.
The latest Omicron variant has starkly reminded the world about what global health advocates have been shouting about for more than a year, that if vaccines aren't shared, the virus and its variants will spread. Canada followed dozens of other countries in announcing more travel bans on African countries. South African scientists alerted the world about Omicron. They were isolated within their own borders for it. Meanwhile, developed countries, including Canada, continue to overpromise and underdeliver, even with COVAX, a global initiative set up to ensure equitable vaccination distribution. Many are now asking, what is the end game here? And what does it say about the world we live in when developed countries are discussing booster shots, while every 3 out of 4 healthcare workers in Africa remain unvaccinated? Ironically, star reporter Alex Boyd was traveling across Africa to report on exactly this. She made it back to Canada from South Africa right under the wire, just hours ahead of the Omicron travel ban. She joins me now to talk about those initial hours of confusion. What exactly are Canada's rules now, and how is all this being seen in Africa on the receiving end? Hi, Alex. First of all, welcome back, and thank you for joining me on the podcast today.
Thank you. Always nice to be on the podcast, particularly nice to be back in Canada this week. So thank you.
It's great to see you safe and sound. And I do want to ask you about that. Have you had your results since you came back? Are you okay?
The fun thing is there's a lot of testing involved now. So I've had my first results. They were negative. I've got a couple more tests to do. The fun thing is they send you home with these at-home kits, and then you get on a video call like this and someone walks you through doing your own test. So it's like someone's watching you swab your own nose and telling you to please put it further up your nose, which is, I think, one of the weirder pandemic experiences I've had so far. But yes, I am well tested. My first results are good. In quarantine. So fingers crossed.
Right. And speaking about further weird pandemic experiences, you were on a reporting assignment in South Africa, and it seems even without knowing it, you were in a race against time. Tell me a little bit about your narrow return window and your experience once you landed here.
Yes, it turns out I was in a race I didn't even know I was part of, but luckily I made it back just in time. But yes, I was reporting in Southern Africa. So most recently I was in Namibia, though previously in South Africa and Angola. And so I was in the Namibian coast. I'd driven to Windhoek. I'd gotten on a plane, gone to Ethiopia. From there, it was 17 hours from Toronto, landed in Toronto, had to run through the terminal to make my connection to Calgary. So by the time I got back to Calgary, I'd been, traveling for, I think, somewhere in the neighborhood of 25, 30 hours. And, as a journalist, we're used to being so plugged into the news, but because I've been traveling, I had no idea what was going on. As lame as it sounds, I posted a picture of Tim Hortons coffee to my Instagram stories.
Yikes.
Yeah, I know. Didn't think I'd have to talk about this so publicly, but anyway, love Tim Hortons.
Same.
Nothing wrong with Tim Hortons. I posted it to my Instagram stories. And actually, one of my former Star colleagues immediately messaged me back and was like, welcome home. You made it ahead of the travel bans. And had to admit, I had no idea what he was talking about. And so he filled me in. I did a quick Google and I realized that while I was, I think, somewhere over Europe, it's kind of hard to tell exactly, but this new variant had been announced and this had kind of sent countries around the world into kind of this panic around, do we shut the borders? What do we do? And so in hindsight, I was very lucky to get back into Canada just ahead of that conversation.
Yeah, that sounds like, yeah, you're finding out literally on the fly as this thing was unfolding. So, what was the scene like when you arrived here? Did you see firsthand how the new rules and the travel ban was being implemented? And how did you figure out what this meant for you as someone just returning from South Africa? Were the rules clear when you arrived here?
It really wasn't. And so, I mean, to be clear, when I got home, this was very much an active conversation, but the new travel restrictions hadn't been put in place in Canada. And so I thought, "Ugh, I might have to quarantine, but I don't know." In the meantime, I went to the store, with my mask on, did a couple things that, I should know if I was in quarantine, but the rules weren't in place yet. The next day, there was a press conference where it was announced that these new rules were going to be put in place. And of course, one of the nice things about working in media is I think I had two different people who were watching the press conference text me and say, "Hey, this is what's coming down the pipeline. You should see if you have to quarantine." And so I got on the phone, calling as traveler Alex, not journalist Alex, but still, jumping on the phone is what we're used to doing. And, a couple hours after the announcement, no one from the province or the person I spoke to from the province, didn't really know what I was talking about. They referred me to someone at the federal government who also didn't really know what I was talking about. I sent an email that wasn't returned. And so, I say this with huge sympathy for how difficult it is to communicate these messages through large bureaucracies. And everyone I spoke to was super nice and really wanted to help me out. But at the same time, it was quite clear that it takes a while for these sorts of things to percolate down to the front line. So I think there's this perception that when, a politician says, we're going to put in these travel rules, that there's like giant gates at the borders that slam shut or something. But in reality, it takes a lot longer for these sorts of things to kick in. And I think, 2 years almost into a pandemic, there's maybe not a protocol for doing this quickly, or there's still some questions about how this should work.
Right. And like you also mentioned in your piece, there were, some government officials who I'm sure know about it now, but you actually had to update some of them on the situation. It does seem a little surprising. I don't know if it seems surprising to you that there's still some confusion around the rules and regulations 2 years into this, and it seems a little bit reactionary. Does it feel like that?
It was surprising to me that I was, calling people a couple hours after this had been announced, after it was national news, after, it was all over my social media feeds. And people were like, "So sorry, what did you hear about Africa?" With kind of this tone of skepticism that I might be making this up. So it was a little surprising to me. I understand that it takes a while to figure out what the rules are going to be. I understand it was very much an active situation. But the fact that this concept at all was news to people, I admit I was a little surprised by.
And you're a journalist. You have better outreach. You have access to information to these officials. But obviously, now we know a few cases of Omicron are already here. But there must have been a lot of travelers on those early flights who probably don't have the clarity on what they were supposed to do and that they were supposed to reach out and, find out what the quarantine rules were, et cetera. And they're out there, right, in their communities. Should that be concerning?
I do kind of wonder what my fellow flight members, I guess, how they accessed the information they got. I did eventually get communication from both the province, I live in Alberta, and federally, but it wasn't until, the weekend or Monday in particular, I got a lot more information having arrived the previous Thursday. And so, I can only hope that they all got that same communication. But again, that was, several days after we could have potentially been wandering around. So yeah, I'm not sure what they would have been doing in those days, but certainly I don't think everyone is lucky as us that work in media to be so tapped into what's going on.
Right. And quickly, is there any more clarity now in terms of Canada's rules on this other than just banning travelers from African countries, which is also highly debated and we will come to?
Mm-hmm. Well, for those of us who've come back, quarantine is no longer recommended. It is mandatory, is my understanding. And so, I'm now in quarantine. There's a certain level of testing that we're required to do as well. But because I'm fully vaccinated, before it was just recommended because it was a bit challenging, is my understanding, for them to say to a fully vaccinated traveler that you had to quarantine. But that has changed, at least as it was communicated to me.
And you talk about luck here in our conversation, and you also talk about privilege in your piece, the fact that some of us are fortunate enough to be able to return to mostly vaccinated countries, while that is not the case for everyone, especially in the global south, right?
Very, very true. It felt almost a little meta reporting on this. I'm reporting on a project that will be rolling out in the Star in the next month or two about the fact that wealthy countries like Canada had, frontline access to vaccines. We have our full vaccination rate is currently around 75%. When you compare that to Africa, they're at around 6% as a continent. Obviously, there's a little bit of variation between countries, but as a whole, the continent has really struggled to access vaccines. And so as a traveler, I've been fully vaccinated for months. I was able to kind of, go travel, talk to people about what this was like. But then at the end of it, I was able to go back to retreat to a part of the world where vaccination is very high and where if something were to happen to me, we have a very robust healthcare system. And so my own story, I think, is really an example of the privilege that Canadians and residents of wealthy countries have, because a lot of countries have not only struggled to get vaccine, but it's not even a question of them not having the money necessarily. A lot of these countries had money in hand. They wanted to make contracts, the same sort of contracts that Canada had made for vaccine, but they weren't able to do it. They were just too far back in the line. So it's not even a question of, them not having the resources. It was, the wealthy world was really able to kind of make this work for them, but at the expense of much of the world.
Right. And very meta, like you said, it's ironic that you were in South Africa, doing a project on global vaccine inequity while this unfolded. And as we know, the WHO and various global health experts have been warning again and again that the virus won't stop spreading and mutating unless you get the root cause, right? Everyone gets the vaccines. Could you talk a little bit more about the role that vaccine inequity might have played in this? How does that work? And how has the West been in terms of its COVAX commitments and just in general about this?
Yeah, that's the great irony. As you say, this is not a scenario that no one saw coming. Omicron, in as much as we didn't know Omicron was going to be Omicron, global health advocates have been shouting from the rooftop for a year now that if we didn't get the rest of the world vaccinated, the whole world would be vulnerable to a variant that was more likely to pop up. And so to zoom in, for example, on, just even one person, anytime one person is infected with the coronavirus, the virus will start multiplying. And every time it multiplies, you're giving it another opportunity to pop up a variant. And so, viruses don't have brains. They don't, mutate for specific reasons. But what they do is every single time they pop up a version that's a little bit different, sometimes it doesn't matter. There's lots of variants out there that are a little bit different, but it doesn't give them any advantage. So no one cares. But every once in a while, they pop up something that might be more spreadable, that might be a little bit more serious. And then that version of the virus starts to outcompete the other versions. So what is that saying about if you give a monkey a typewriter, it'll eventually type the works of Shakespeare? If you give the virus enough time to pop up little different versions, enough chances to infect people, to have, replication errors, eventually it's going to pop up something that's really not good for us. And so that is the concern by leaving so much of the world unvaccinated, is we're giving the virus a lot of opportunity to come up with new versions that are going to be bad for all of us.
We'll be right back. And you've been talking to stakeholders there. You've been reporting from South Africa and other African countries. What's the sense there? Is there a sense that Canada and other Western countries have not done enough potentially to create vaccine equity? What's the mood like there?
Yeah, we all have the same internet. We all have same access to the same international media. And I do think there is a real sense among a lot of people, when vaccines started rolling out in Canada, in the US, in the UK, we were thrilled. I remember being thrilled. But people in other countries watched that and said, okay, when are we getting it? And I think they realized that they might be a little bit slower to some parts of the world, but it's been a lot slower. And this hasn't been lost on people that, they've been left out in this vaccination effort. And when it comes to Canada in particular, it's kind of interesting because when I asked, there's this lawyer, Fatima Hassan, who's been a huge part of the vaccine equity push in South Africa. When I put this question to her, I was like, Canada's a small country. We don't have a lot of power. Does it really matter what Canada does? And she actually laughed because she was like, Canada talks a big game on international stage, I'm paraphrasing here, of wanting to help others, wanting to be a good neighbor. Their whole thing is having healthcare that's accessible to all. Where is that Canada in this? Why is Canada not doing more to make sure that that is principles that can be applied to everyone? And so I do think there is almost a higher moral expectation for Canada here. And again, Canada has started to donate vaccines. We've started to dip our toes into these waters. But I think there are real questions about why we haven't done more and why we haven't gotten more involved in things like intellectual property that would have allowed the rest of the world to manufacture vaccines. So I think it's fair to, scrutinize Canada's role here a little bit.
And the other countries under COVAX as well, from what the WHO keeps saying and from some of the facts which might have changed now since there's more distribution ongoing, but very small percentages of what was sort of committed under COVAX have been delivered, right?
Yes, we haven't delivered everything that we committed. Some of the vaccines that we've committed are things like Novavax. We've committed a bunch of our doses for that, but that's a vaccine that hasn't been authorized anywhere yet. And so again, it's something that looks good, but hasn't actually gone anywhere. And particularly the thing I think that upsets a lot of people about Canada is the role Canada has played in what some people have termed vaccine hoarding. And so when you look at the number of vaccines that Canada has bought up for itself, if all of those vaccines were authorized, and in fairness, probably not all of them will be, we would have enough vaccine purchase to vaccinate the entire country 6 times. And so I think people really see Canada's donations in the context of how many we actually control. And so I think that's definitely part of why people are frustrated with Canada right now.
Mm-hmm. And it's obviously not just even a point of charity at this point. It's actually about how connected we are, how globalized the world is, and how it's in everybody's interest for an adequate distribution of the vaccines.
I think this idea of charity is probably one of the biggest differences in mindset between, say, Canadians and people, for example, I was speaking to in South Africa, because I think Canadians really see the vaccine donation thing as a nice charitable thing. Like, oh, well, we have extra, we want to help others, we're going to give extras to other parts of the world, which is great. I mean, that's a nice thing that Canada is doing. But a lot of people in South Africa are saying, well, why do we have to wait for your cast-offs? Why don't we live in a world where we could have ordered our own vaccines or what we could have made our own vaccines? And so there really is, and the reporting that I'm doing, we'll get into this a lot more, but there is a growing push to break that cycle and really let them stand on their own 2 feet, I guess, when it comes to vaccine access.
That makes sense. And Alex, you talked a little bit about how many in South Africa might have the sense of stigmatization of being punished for what seems like the ideal international response, right? In this situation, they were, from what I've read, actually proactive and efficient in sequencing and screening and then alerting the world to this variant. And now we're seeing their travelers are banned by Canada and other countries. Does that seem fair? What are people sort of saying about that?
That's definitely the perception I'm hearing. A lot of the scientists, I spoke to or, was able to tour their labs or learn more about the work that they're doing. When I've seen kind of how they're reacting to this, it's almost an emotional reaction in some ways. Like, I think there is a lot of anger because from their perspective, they did what you want one of your neighbors, on the global stage to do. They detected the variant quickly. And as soon as they knew what it was, they alerted the world so that everyone else knew what was going on. And then they immediately ran back to their labs to keep doing the work to find out whether or not Omicron is actually more spreadable or, is able to evade the vaccine. So in their view, they did the work and are now getting punished for it. And I think it's worth noting, for example, that, Omicron has now been detected in multiple European countries. Do we have travel bans against Europe? Nope. It's just Africa. And so I think when they look at that, they're making judgments about, how they're being treated in a global pandemic when they're just trying to do the right thing. And I don't think those are the sorts of hurts, I guess, if I can use that word, that are going to be going away anytime soon.
Right. And does that kind of play into harmful misconceptions that are created about the global South? I know that there was an idea that somehow South Africa is responsible for Omicron when they actually helped identify it. So there's that kind of narrative going on.
Yeah. And I think there's a couple threads there. The first is they're like, well, we do have a lot of unvaccinated people here. Again, to be clear, Omicron was first detected in South Africa. We don't know where it originated from. But if it did originate in Africa, I mean, they have had such a hard time getting access to vaccines that it seems the perspective I'm hearing is that, they were denied vaccines, they weren't able to protect their own population. And so to a certain extent, they were prevented from doing the work that would have stopped the creation of a variant. And so I think that's part of it. I think the other piece of this is a lot of scientists, I think, take umbrage at the idea that they don't know what they're doing, or they don't know how to track the variants, or they don't have the capacity in country to figure this out. South Africa has a long scientific tradition born actually out of HIV. In a lot of ways, their COVID response is built on the shoulders of what they did during HIV. And so they have, a very, very robust scientific community, and they feel like that's really being ignored right now.
And they have a pretty sophisticated surveillance and sort of sequencing structure based on the previous epidemics, like you mentioned, right? And they're still researching despite some of these barriers that you talk about.
They do, yeah. They created a cross-country monitoring system very early on in the pandemic to kind of do this variant tracking, but then also to raise any issues to the national level so that they could have a coordinated response. And so that's the network that discovered Omicron. But then they also have, and I was actually able to tour this lab while I was in South Africa, they have a lab that is doing this specific work. And again, this is an HIV lab that is pivoted during the pandemic to figure it out whether or not Omicron is able to escape the vaccines. This is the same lab that was the first to realize that beta could escape the vaccines. And so they're now racing to do that same work for Omicron. And so again, they have this scientific foundation within the country, and they're really just kind of begging the international community to give them more time to figure out exactly what we're dealing with here.
And Alex, with this Omicron and like all that means for the world, do you think this could be the thing that helps other countries now take this more seriously and sort of push internationally for, comprehensive systems to be put in place to address vaccine inequity?
As someone who's been following this for much of the year, I feel like there is a focus and a tension, I guess, right now on vaccine equity that is new. I have not seen the level of interest and the level of coverage that I have before Omicron was announced. And so as horrible as it is that it took something like this to kind of alert people to the issue, I do feel like there's kind of a renewed attention on it. I mean, I think something to watch if people are interested in this issue is, of course, Canada's donations. How many are we donating? Where are they going? But the other thing to watch, and I don't want to go too down the rabbit hole here, but is the issue of intellectual property. And so there's a real push for what's called the TRIPS waiver. And so the TRIPS waiver would be like a magical get out of jail free card, I guess, that would allow companies to produce these vaccines without getting in trouble over intellectual property from the people who initially developed them. So for example, if I had a vaccine factory and I had the ability to produce, the Johnson vaccine or something, this would allow me to produce a bunch of the Johnson vaccine. I'd still have to pay Johnson probably, is my understanding. Like this wouldn't be them totally losing out here, but it would allow me for a limited period of time to produce that Johnson vaccine to try to get more supplies to the rest of the world. That was supposed to be discussed at the World Trade Organization meeting this week. That was then delayed, ironically, because of Omicron. But this is something that's been a big discussion for the last 2 years, kind of flown under the radar, I think. But Canada has been kind of on the fence here. A lot of people want Canada to start maybe taking an active role here. So that's also something to watch if people are interested.
Right. These are important developments to keep an eye on. Thank you so much for your time and insight, Alex. We're very glad to have you back safe and sound with us. And I look forward to talking to you more about your reporting in South Africa.
Thanks, Saba.
I was talking to Alex Boyd, who's a Calgary-based reporter for the Toronto Star. That's it for today. Thanks so much for listening. I'm your host, Saba Itazaz. The This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mutter, and Sean Pattington. Our music is by So-Called, Mike DeAngelis, and Sean Pattington. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.